You're watching MIHAS International. Good afternoon. For the interview section today, I have Don Lavender. He's a psychotherapist and he's Programme Director for Camino Recovery on the coast. And he specialises in treatment for varying addictions. Don has more than 30 years of experience, and this is in clinical management and consultative positions. He's worked in some of the well-known treatment centres all over the world, including Priory Hospitals in the UK and Sierra Tucson in Arizona. The last time Don was on the programme, we talked generally about his specialist treatments and the services that the Camino Recovery offer. Now today we're going to do sort of like a part two, looking into this in more detail. And Don's going to discuss the most effective therapies available throughout the world's top clinics, amongst other things. Good afternoon, Don.
Good afternoon.
And lovely to have you back.
Well, thanks for having me back.
Yeah, thank you. And as I said, last time we sort of like covered topics in general, just to give the idea of what Camino Recovery was about, and a little bit about the depth of experience that you have as well. Now, we were talking about effective therapies available throughout the world's top clinics, and you're going to explain what these therapies are about, what people should be looking for, what questions they should be asking as well.
Yes, it's I wouldn't say age-old questions, but the questions that are most often asked once in-depth discussions take place. People want to know, what do you do? How do you do it? Why do you do it? And at Camino Recovery, we offer basically 5 areas of therapeutic intervention. And the first is Hazelden 12-step program of recovery. This is copied from the 12 steps of Alcoholics Anonymous. It happens to be the most effective kind and type of approach dealing with addictions. Addictions in general? Addictions in general. Regardless of the substance or the compulsivity or the behavior, it happens to be the most successful thing, again, for the largest number of people.
Okay. Go on,
we also do CBT, which is cognitive behavioral therapy. This is big in the UK. It's quite effective. And cognitive behavioral therapy was born out of rational emotive therapy. And there have been other kinds and types of therapies that have evolved from cognitive behavioral therapy. And basically, I mean, it's quite complex, but if you had to boil it down, cognitive behavioral therapy basically is, if your thinking doesn't change, a lot of other things aren't going to change.
Your habits aren't going to change.
Yeah, your habits aren't going to change. And so it helps people come to a clearer definition of, what do I think, what do I feel, how am I behaving, does anything need to change? If so, action a plan and move toward that and find out what's most effective for you, what works for you. Another thing that we work with is trauma resolution. The most successful centers in the world have discovered, and it's taken them decades to figure this out, that people that have repeated problems, that you can't just go through a short period of therapy, or you can't just go through treatment in a residential care center once.
A one-off.
A one-off. It's if the pattern repeats itself, then it's not that I'm a bad person because I can't figure that or I can't sort it. It's generally a product of trauma. And I know I've said on the program before, is one of the greatest contributors to relapse or continued problems is stress. And probably the greatest contributor to stress is unaddressed or unresolved trauma. And the most successful centers in the world address trauma. And there are different kinds and types of therapies that can be used to address that. When I was a boy, you know, when I first started working with clients in trauma, sometimes it would take years of, you know, meeting for an hour once a week to address and resolve different traumas. And in this day and age, there's something which is called somatic experiencing. there's also something that we use, which is most effective. It's called EMDR, or eye movement desensitization and reprocessing.
I was going to ask you what that meant.
Well, EMDR, or eye movement desensitization and reprocessing, is quite a long name for this kind and type of therapy that was created by Francine Shapiro in the late 80s in California. And what it is basically is it's bilateral stimulation. And what it does is it involves, tapping or sounds or tactile vibrational objects in hand, particularly eye movement back and forth. Not your head back and forth, but just your eyes back and forth. Initially, people thought that there was a connection between that and a chemical release in the frontal part, the frontal lobes, the brain, which released subconscious memory or subconscious thought. Because inside the brain is the limbic system, which is the mammalian brain wrapped around the reptilian brain, which is deep inside the neocortex. Trauma is housed there. And EMDR very quickly, rather than years, you can solve or resolve this work in weeks, even rather than months. And what it does is it allows you to reframe the traumas. And reframe means I can look at the trauma and say, yeah, it happened, and it was horrible, and I need to move on. And what it does is it allows you to look at the trauma in a different way, as opposed to the trauma incapacitating you. Another thing that we do is we do family systems work. Now, family systems education and information is about employing the family, bringing them into the picture to work with the addict or the designated patient. It's not just addiction. We work with addiction, depression, anxiety, mental and nervous disorder, all those sorts of things. And we involve the family, and it can be very unpopular.
I can imagine.
To say this.
Yeah.
Because families, what they do is, we have this problem child. They've thrown the net over him, and, it's Uncle Ralph. Uncle Ralph drinks too much, and they throw Uncle Ralph in treatment and say, fix him. And we say, well, we want you involved. Oh, no, not me. I'm up to here with Uncle Ralph. And the reality is if there's a problem, an addiction problem, a mental health issue, it is a family issue. It's not just the issue that belongs to the individual. One of the secrets, or one of the ways that it was discovered that it was a family issue, is in family therapy. And this happens all the time, not most of the time, every single time. Get mom and dad to come in and talk to the therapist. And whatever mom and dad are saying, they're articulating, this is the issue, these are the problems, these are the things we must address. In less than 10 minutes, the children will act out the family problem.
Really?
Really. Now, whether the children are sitting among the parents, or whether the children are over in the corner playing with the toys that the therapist has on the carpet, the children will act out the dysfunction.
That's interesting.
And again, I know this sounds weird. It doesn't happen most of the time. It happens every single time. Because any problem is a family problem. And so family members, they need to have information and education about the reality that they did not cause their family members' problems.
Yes, they did.
They cannot control these problems, and they can't cure it. They can't fix it. They often do try to control. And they get fed up with trying to control it. They try to fix them, and they can't do it. And a lot of times, it's parents that show up that are full of shame because, I'm a bad parent. What did I do wrong? Well, you didn't do anything wrong. What's happening is you can't cause this.
No.
And even the therapy that takes place in a family workshop, it isn't about fault finding. It's about where do we go from here. And the client, they're not at fault either. They're not to blame, but they are responsible. And it's important to give family members the information that the client's responsible, not you. It's no longer your job to try to fix this. It's their job
Yes,
to make
it's
healthy
in
choices.
their hands.
Yeah. And these are the things that you may have done to contribute to enabling this person to stay active in their addiction. Now, these are the things that you can do to no longer enable that person to stay active in their addictions or their problems. And seriously, I'm not talking about a weekend visit where you get to chat with the counselor or you sit in a group for an hour. I'm talking about a week-long workshop. Intellectually, humans move very quickly. All of the information that's given in a workshop for family members, you can get this information. You can actually intellectually digest it in one day. But people do not move that fast emotionally. You need time to get information, receive information, and sit with it. Even sleep on it. And come back each day.
Yes, because it's things that they'll become aware of that they'd never even considered. And I suppose that's something they've got to digest, think about, and then come back with maybe something else, or how they can change the way they do things as well, you know, the way they react.
Exactly. Yeah. And not only does the client need to clean up their act, you know, and start exercising some of the tools they have been given to lead a healthier life, the family members need to clean up their act and no longer do behaviors that enable the addict to stay active in their behaviors. This is all easy to say, but it takes a few days to give family members this education, this information, and let them move through it. And we also do equine...
Sorry, just before you talk about the equine therapy, I would think, is it true to say that the family workshop treatment is one of the most important in the client moving forward?
It is.
Yeah.
It is one of the most important things. And again, very unpopular to say this, and I used to say this in the UK at conferences and lectures, that programs that treated alcoholics, for example, but they did not offer a family component to their care, were offering half of a program at best. And again, it's not about them being bad. It's just that they haven't been trained. They don't know this. They don't have this information. And it is a discipline, and it is an exact skill to learn. And you have to be trained to do it.
You have to, yes, of course, yeah.
And it's another thing. It's, the questions that when people call centers, they want to know, who are you? What do you do? They also, how much does that cost? The important questions to ask centers are, who are your staff? What is their background? What's their training? Did I take a 6-week correspondence course on the internet to get my counseling diploma? Or do I have a master's degree or a PhD? Where have you worked? Where have you trained? What do you deliver? What's interesting is when you work in residential care, there's a big difference in the kind of counseling that is offered to clients in residential care as opposed to the kind of therapy. Counseling is therapy and therapeutic, but outpatient, what people normally receive is something that's called psychotherapy. It's where you take time to investigate things with clients. If you used psychotherapy as your only tool in residential care, you will go nowhere in a month, because you don't move very fast. Addiction counseling or addressing, depression, anxiety, these things, you have to be trained to work and to have laser pinpoint accuracy with these are the issues that must be addressed.
Straight to the point.
Straight to the point.
Yeah.
Rather than, let's take our time to investigate these issues.
Yeah.
No, people's time is valuable. people's money. They want value for money. And, you know, if I've been someplace for 3 or 4 weeks, what have I gotten out of this?
Because it's your life at the end of the day, isn't it?
It is.
Yeah.
It is. And, you know, one of the things that I tell people when they're on the phone asking about even costs, they say, oh, that's a lot of money. And I say, you bet it's a lot of money. And I promise you, treatment will cost a lot less than your addiction.
Yeah, that's very good thing to say.
Well,
they don't think of it like that.
But that's why it's important to investigate. Who are your clinicians? Who are your people delivering the clinical product? What is their education? What is their experience? Where have they worked? Where have they been trained? What do they know? What do you do? And it's not about whether people that work in a center are good people. I mean, I'm guessing that everybody's basically a good person, especially if you're in the people-helping profession. You know, as my wife says, bless their cotton socks. But it is, and it's so important to figure out and ask those poignant questions. You know, what is the education training skill level of the people that work at that center? And we also do equine-assisted psychotherapy.
Yes, you were there at the very beginning with the, you know, pioneering this, weren't you, in Arizona?
Yeah, I was at I was working at a psychiatric hospital in Tucson, Arizona that started this. There were other organizations in the world that were actually working on it and developing it at the same time. They did not know us, we did not know them. And it has evolved, and it evolved, and when it evolved and when we were working on it, we did not know what we were developing. We didn't know what we were doing. It just happened to be quite effective. Again, there are programs that involve horses and working with emotionally, physically, mentally handicapped children. Those sorts of programs, those have been in the UK probably for almost 80 years. Been around for a long time. Great programs, very successful. But equine-assisted psychotherapy is moving to the next level of teaching people about boundaries, about enmeshment. Where do I end and another person start? Am I in touch with truly what I think? Am I in touch truly with what I feel, what my emotional states are? Do I communicate clearly in relationship? Do I communicate clearly with self as well as others? Horses are fantastic creatures to teach you this.
Is it because they tune into you, so they reflect the mood? Or
they do reflect your mood. I mean, a horse can detect whether you're nervous or anxious, even if you're standing next to them. And they can detect rapid or shallow breath, increased heart rate. I mean, horses are, by their very nature, hypervigilant. And people that are trauma survivors, for example, they're also hypervigilant. It's one of the exhibiting factors that they exhibit. It's one of the behaviors they exhibit. And horses react and respond to people that react and respond in a certain way. And there are people that, you know, they think, well, I'm not scared of horses. But they get out there and they are fearful, and the horse is skittish and is acting funny. And oftentimes I ask the client, what's going on with you, or why I see this going on? And they often ask me, well, how do you know that? And the reality is, I'm not looking at them, I'm looking at the horse.
Yeah.
Because the horse is a perfect mirror. And, you know, horses respond to pressure and release. And, you know, that's a Pirelli-ism among the horse world. And we teach clients to exercise pressure and release. And we also teach clients to do simple things like grooming or cleaning out a hoof with a hoof pick. Getting the horse to do certain things, to walk with them, lead them. And what we do is we call these congruent message-sending exercises. And what a congruent message-sending exercise is what I think I want to happen, my intent or feelings connected to what I want to happen, as well as my body language in connection to what I want to have happen. If those three things align, the behavior often happens.
Okay.
What I'm asking of the horse will happen. But even if cleaning a hoof, for example, if there's a small part of me here that says, oh, I'll never do this, even if a small part is not aligned,
then
it's probably not going to happen.
no. So it's got to, well, following through really with the whole process, isn't it?
Yeah.
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 Well, thank you very much, Don. That was really interesting. Thank you.
Okay.
And we'll catch up again very soon. Thank you.
Thank you.
And yes, that's Don Lavender and from Camino Recovery. We'll be catching up with addictions in more detail with him in a few weeks' time. That's all for Mijas International, and the Mayor of Mijas will be back with you tomorrow with the management report with Gabby Ray, and you'll be updated on the latest municipal news. Don't forget that the Mijas Semanal weekly newspaper is out as well. It's free, 8 pages of information in English and the rest in Spanish. Hasta mañana.